Hey, Rod.
Hello.
Hi, I'm John. I'm going to be your nurse practitioner student this evening. I'm just going to ask a few questions before we start. I'm just going to wash my hands, okay? Okay. I'm going to wash my hands, and then before we start, I'm going to put on some gloves, okay? Just to be clean here. Okay. All right. So what brings? Can you please tell me your full name and birthday?
Rod Aminzadeh, November 12, 93.
Okay. And then, Rod, what year is it right now?
2025.
What building are we in?
Came to the Charles Drew Hospital, I think.
Okay. And then, what are we? What brings you in today?
Just need a physical for my school. I have some forms. If you don't mind filling out later, that would be great.
Not at all. What are you doing for school?
Just doing nursing.
Okay. Oh, very cool.
Yeah.
Awesome. Congratulations.
Thank you.
So Rod, before we start, I'm just going to go ahead and ask you a little bit about your history, if that's okay.
Yeah.
Any medical history that I should know about?
No, just appendectomy when I was in middle school.
Okay. Okay, that satisfies my next question for surgical history. Any allergies to medication?
No allergies.
Okay. And then, can you tell me any family history that you may have?
Just heart problems with my dad and my mom. She's okay.
Let me just double check. See if it's
She's
recording.
She's doing good.
Okay. We're recording. Okay. And then, so heart problems with your dad. Okay.
Yeah.
And then, you said no allergies. I'm gonna ask you about social history. Any smoking?
No smoking.
No smoking? Any drinking?
Just occasionally with friends.
Okay.
A couple drinks here and there.
And then, lastly, any illicit drugs?
No drugs.
No drugs. Okay. Alrighty. And then, besides the physical assessment, is there anything else that you are concerned with?
No, that's it.
Okay.
Everything's good.
Alright. So let me go ahead and take your vital signs while we do that. As I'm taking your vital signs, just wait for it. Okay. Your vital signs are unremarkable. It's 120 over 80, pulse is at 60, respiration is 18, and then your oxygen saturation is at 100%.
Yeah, it's okay if my dog is here. It's a service dog, you know.
Oh, that's
they
fine.
Cleared in the front.
Oh, yeah, he's
So
totally
that's-
fine.
Yeah. Okay, just like.
Okay. Thank you very much.
Yeah.
I'm totally fine with that, as long as you're comfortable.
Yeah, perfect.
And then, so the patient is alert and oriented times 4. The patient is well dressed, does not appear disheveled. The patient is, his skin is clean, dry, and intact, and his skin color is consistent to ethnicity. Okay, right, I'm gonna go ahead and start the assessment. Would you like a chaperone today?
No, it's okay.
Okay. All right. I'm just gonna start off with your head, okay? All right, I'm just gonna palpate your head, inspect your head. Okay, the head is normal cephalic. All right, and let me know if there's any pain.
No pain.
Okay, there's no tenderness or lumps.
None.
And the skin appears smooth and symmetrical. Okay, Rod, I'm just gonna go ahead and do your eyes. I'm just gonna pull down your eyelids. Here, if you can look up. Look to your left, look to your right, okay. The eyelids are intact. The conjunctiva is clear with no discharges. The sclera is anecteric, which means no jaundice bilaterally. Okay, I'm now gonna take my ophthalmoscope and then inspect your eyes really quickly. Just if you can, just look at my right eye with your right eye. Okay. And then my left eye with your left eye. Just look at my ear. Okay. Alrighty. So the I see for the eyes, I see 2 arteries and 1 vein. No discharges noted. Okay. All right. Okay. I'm now going to inspect your nose. Okay. The nose is, there's no deformities, no lesions, there's no scars. And I'm going to check the inside of your nose. Can you do me a favor? Okay. Inspect your nose. And then, Rod, can you do me a favor too and just hold one nostril and blow? Okay. Okay. And then I'm just gonna feel. Okay. So, nose is patent. the mucosa is pink. There's no polyps. The septum is at midline, and there's 3 turbinates that are pink. Okay, at this time, Rod, I'm just gonna look at your ears. Okay, I can see that they are no discharges, no perforations, and no lesions, and no mass discharges. I'm gonna go to your right ear and look. Okay, I can see a clear canal and a poorly gray tympanic membrane, and then the cone of light is shining exactly at 5 o'clock. Okay, I'm gonna go on the other side, on the left ear. Okay, again, clear tympanic membrane, pearly gray tympanic membrane. There's no discharges, a clear canal, and here on the left ear, the cone of light is shining at 7 o'clock. Okay. At this time, I'm gonna check your neck. All right. I'm just gonna push on your neck a little bit, inspect your neck. All right. Can you do me a favor and flex your neck for me? There you go. And then flexion, and then retraction. Yeah. And then if you can rotate your neck for me left and right, and then if you can laterally just push your hands against here and then here. Okay. All right. Okay. Okay. Let me just see your mouth. Can you open your mouth for me? Okay. And then stick your tongue out. Okay. And then let me just see your tonsils. Yeah. Okay. So, and then can you show me your teeth? Okay. Alrighty. So, do you have a pink gingiva, and then your there's no tonsil pharyngeal congestion. Very good. Okay. And now I'm going to inspect your throat, your neck rather. Let me just inspect. There's no pulsations. There's no lumps. Okay. Any tenderness or pain here? No. Okay. Any pain or tenderness here? All right. And then while we're here, I'm just going to go ahead and check your carotid arteries. I'm going to first use my diaphragm and then my bell. So by inspecting, I can see that there are no visual growths. And then I'm going to inspect with my diaphragm and then my bell on the left side, and then my diaphragm and then bell. So there's no audible growths in your carotid arteries, and then +2 pulses on both sides. Okay. And then Rod, I'm just gonna go right behind you, so if you can, just sit right here on this chair. Very cool. All right. Before we do that, I want to inspect your lymph nodes.
Okay.
All right. All right, and let me know if there's any pain or tenderness on your lymph nodes. Okay. So your preocular, your postocular, your occipital, your submental, your submandibular, your jugular digastric, your posterior cervical, and just turn this way. Yeah. Your deep cervical, very good. And turn this way, deep cervical. Your anterior cervical, and then your supraclavicular. All right, any pain there?
No.
Okay. So the patient doesn't have any lymphadenopathy. All right, now I'm gonna go around and check your trachea. I'm gonna use 3 fingers to hold it together and the other 2 to push, okay?
Okay.
And just let me know if there's any pain. Can you do me a favor and swallow? Any pain?
No pain.
Okay, and then 1 more, 3 fingers, and then 2 fingers.
No pain.
No pain, okay. No pain or tenderness in the trachea. Alrighty. At this time, I'm gonna inspect your spine. The spine appears symmetrical. Okay, let's let me know if there's anything tender.
Mm-hmm.
Okay. Okay. No tenderness on the spine.
No, nothing.
Okay. And then Rod, can you do me a favor and then just touch your toes for me? Okay. And then go back up. Okay. So the skin is symmetrical in color. There's no kyphosis, lordosis, or scoliosis already. So at this time, Rod, what I'm gonna do is I'm gonna check the anterior part of your back. And just do me a favor and take a deep breath. Good. Symmetrical chest expansion on respiration. Okay, and then I'm gonna do tactile femoris. So just do me a favor, I'm gonna place my hands on 5 parts and just say 99 as I place my hands.
99, 99, 99, 99, 99.
Okay. All right. Tactile femoris equal and bilateral. At this time, I'm gonna percuss my hands on your back to check for sounds. The patient has resonant lung fields. Good, Rod. So at this time, if you can, just move slightly forward. And then just turn towards the camera here, or turn the other way. I'm just gonna check all auscultate your lungs in 9 different parts. Right. Do me a favor, can you sit up? Yeah. Good. You just. Take your time, yeah, it's 9 breaths, it's loud. 3, 4, 5, 6, 7, 8, 9. Okay. Auscultatory heard on lung sounds, there's no wheezings and no rails noted. Okay, at this time, Rod, what I'm gonna do is I'm gonna do it's called the costa vertebral angle. I'm just gonna do a kidney punch test. It's gonna be below the 12th rib. Let me know if there's any pain. The 12th rib is right here. Any pain?
No.
Okay, and then any pain?
No.
Okay. No CVA tenderness or kidney punch pain. Very cool. I'm now gonna move in front of you, right. And I'm gonna check the front part of your anterior chest. All right, and if you can, just do me a favor and breathe. Okay. Symmetrical expansion on respirations. Okay, and at this time, I'm also going to do tactile frenesis. It's going to be on 4 parts. Deep breath. 1, 2, 3, 4. Okay, very cool. All right, I'm now going to auscultate the front part of your chest. Okay, here you go. And this is going to be on 5 areas. Breath in. All right, you okay?
Yeah.
Okay. Okay, now I'm gonna check your pericardium. I'm inspecting your pericardium. There's no heaves on your pericardium. At this time, I'm gonna look at your point of maximum impulse, which is the left midclavicular fifth intercostal space, midclavicular line on the left side. So right here, I'm just gonna palpate here, okay, for 1 minute. Okay, it's been 1 minute. Okay, all right. Maximal impulse noted, and at this time I'm going to auscultate to check for rate and rhythm. Sorry, I know this is a long test run.
No, I mean, I did a double shift at work, that's why.
Okay, alrighty, okay. So equal rate and rhythm on. At this time, I'm going to check all four oscillatory areas of your heart, starting with the aortic, pulmonic, tricuspid, and then again the mitral. All four oscillatory areas are noted. Alright. So at this time, Rod, if you can, just lie 30 degrees for me to check your jugular vein distension. Okay. Alrighty. So I can see that there is no external jugular vein distension. Okay. So up next, Rod, we're gonna do the abdomen. So if you can, just whatever makes you comfortable, lay down. Just make sure you're facing. I know you're tall.
We'll figure it out.
Yeah. All right. Just gonna go on your right side. Okay. Okay. So I am inspecting your abdomen. I see that there is no perforation. There's no. It's flat and globular. There's no lesions. There's no scars. Okay, Rod. Now I'm gonna auscultate your vowel sound, starting with the right lower quadrant. Okay. Right upper quadrant. Left upper quadrant. Right lower quadrant. Okay. And then I'm also gonna auscultate. So normal vowel sounds on all four quadrants. I'm gonna also auscultate your arteries, starting with the aortic artery, and then the renal, the iliac, and then lastly the femoral arteries. Okay, very good, Rod. So Rod, right now I'm looking at your lungs. What I'm gonna do next is I'm going to percuss the liver edge, okay? And I'm just gonna listen here, so I hear which the liver edge is on the right mid-clavicular line. I'm just gonna tap here. I hear a resonant sound, resonant, resonant, and then I hear dull, 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 then resonant, resonant. So Rod, your liver edge is about 7 centimeters, and then I'm also gonna do it with your spleen. Okay, and then your spleen is tympanic. Okay, Rod, at this time, since I percuss your liver edge, I'm gonna go ahead and palpate all, all four quadrants. So I'm gonna start off with one hand, softly, and then I'm gonna go ahead and do two hands, a little bit more aggressive. All right, any pain there?
No.
Okay. Palpation soft on all four quadrants, no pain or tenderness. At this time, I'm gonna palpate rather your liver edge. Okay, I'm just gonna put my hand behind you and feel here. Okay. No liver edge noted. No hepatomegaly. And then I'm gonna go here. Okay. No spleen noted, no splenomegaly. All right. So since we're right here, I'm gonna go ahead and check for your femoral artery and your inguinal nodes, which is a very sensitive area. I'm just gonna pretend. All right. No inguinal lymphadenopathy noted. Alright, and Rod, since we're right here and we're laying down, I'm gonna go ahead and check your pulses.
Okay.
Okay, starting with the brachial pulse, the radial pulse, which is closer to the thumb side, the ulnar, which is close to the finger, the pinky side. Okay. And then finally, a couple more actually. I'm gonna check for your popliteal, your dorsalis pedis, and your posterior tibialis. Okay. All right. Okay, Rod, go ahead and sit up for me if you can. Okay. Alrighty. So I would check your extremities. I'm going to go ahead and start with your cranial nerves. Okay. So for cranial nerve 1, this is the olfactory. I have lavender in one hand, and then some coffee beans on my left. I'm just going to test. Just close your eyes. What do you smell?
Coffee beans.
Cool. All right. Here.
Lavender.
Okay. Very good. Cranial nerve number 1 intact. Okay, I'm now gonna check for confrontation and your visual acuity. Rod, if you can, for confrontation, just cover one eye. All right, how many fingers am I holding up?
3, 2, 1.
Okay, very good. And then cover the other eye.
1, 2, 3.
Okay. Visual fields full by confrontation. Okay, I'm gonna hold the Snellen chart if you can. All right, just read the second line.
874.
Okay, and then read the next line.
2843.
Okay, very good.
432.
Okay, visual acuity by Snellen chart is 2020. All right, next is the cranial nerves 3, 4, and 6. For cranial nerve, for this, I'm just gonna hold this pen, and if you can just follow, it's called the sixth field of gaze. All right, if you can just look at the pen. I'm gonna make a letter H already, starting. Okay, alrighty. And then the next one is the optic, or the next one is, I'm gonna shine a light in your eye, okay? Okay. There you go. There you go, okay. And then if you can, just keep looking at this. There, as it gets closer. Okay, very good. Cranial nerves 3, 4, and 6 are intact. Next is cranial nerve number 5. This is going to be a pinprick test. But I had it with me. Okay, very cool. And you just let me know if it's dull or sharp. This is going to be the dull side. It's what you feel.
Okay.
This is going to be the sharp side.
Okay.
I'm just gonna do it on your face, okay? Let me know if it's dull
Dull.
or sharp. And that here.
Sharp.
Good. And then
Dull. Dull.
very good. Visual fields by pinprick noted by the patient. Okay, next is cranial nerve number 7. This one, if you can, you're just going to do a lot of stuff with your face. If you can, you just do me a favor and clench your teeth for me. Smile, okay? And then act like you're mad, like you're frowning, okay? And then show your teeth, and then close your eyes really tightly, and then a big smile, okay? And then I'm just going to put my hands underneath your chin, and then just try to open your mouth. Let's try to close it. Okay. Okay. Cranial nerves number 7 intact. Mouth closed with resistance. Okay. Next is cranial nerve number 8. If you can, Rod, this is the ocular nerve. Just cover one ear. Okay. I'm gonna say something in your ear, and let me know what it is. I'm gonna whisper it.
Banana.
Okay. And then the other ear.
Orange.
Okay. Whispered words heard clearly on both ears. Cranial nerve number 8 are intact. Okay. And then next is cranial nerve number 9, which is the cranial nerve number 9. Okay. Oh yeah. Open your mouth. Yeah. Okay. Cranial. Okay. Cranial nerve number 9. Okay. There you go. Can you open your mouth? Okay. There you go. Can you say ah? Okay. Cranial nerve number 9 are intact. The uvea is at midline and moves on phonation. Okay, cranial nerve number 10 spinal, is the gag reflex. I'm just gonna put something underneath your mouth. And there you go. All right. Okay. Patient is able to gag, positive for gag reflex. Cranial nerve number 11 is the spinal accessory, and if you can, this is resistance. Okay, very good. Cranial nerve number 11 is intact. Okay, and then cranial nerve number 12. Can you say light, can you say light, right, dynamite?
Light, right, dynamite.
Okay. Cranial nerve number 12 is intact. Alrighty. The next thing that I'm going to do is, after your cranial nerves, I'm going to check for your range of motion. If you can, Rod, go ahead and slide down again for me. Okay. Your dog's really nice.
Yeah, he's very supportive
Yeah.
of me doing this exam done.
Okay, very good. All right, so I'm gonna, and just make sure that your knee's bent, okay. And then I'm just gonna extend this leg at a 90-degree angle. And let me know if there's any pain. I'm gonna do it as a 180. Okay, and I'm gonna do inversion and eversion, and then abduction, sorry, kind of like you're doing like a snow angel, abduction and adduction. Okay, and then same on the other side. I'm gonna do 90 degrees, okay, and then 120, okay, and then eversion and inversion, okay, and then adduction and abduction. Okay, there you go. You can sit back up. Alrighty, so at this time, Rod, I'm gonna check for more range of motion. Can you bring your palms out? Okay, and do pronation. Yeah, just bring your palm. Yeah, and then supination, and then flexion, and then extension. Okay, then bring down your arms for depression of your shoulders. Yeah, yeah, and then and then extension. There you go. And then can you do circumduction? Yeah. Okay. And then the other arm for circumduction. Okay. And then can you do protraction? Very good. And then retraction. Okay. And then again with the head, can you do extension? Yeah. Rotation and then rotation. And then flexion. Alrighty, range of motions are intact, no pain noted on movements. Okay, Rod, at this time, we're gonna do your reflexes. Okay, so I'm just gonna start off with your brachial. Sorry. Okay. Okay. And then your brachial radialis, which is right here. Okay, and then right here. Okay, and then the knee. Okay, and the knee. And then the ankle. The ankle. Good. And then lastly, the triceps. Triceps. Alrighty, good, Rod. So we're getting, we're almost there. If you can, do me a favor, we're gonna do your test your sensations. So similar to the other one, we're gonna test sharp and dull in your body. You just let me know if you feel sharp or dull.
Okay.
Okay. Again, this is the sharp.
Okay.
This is the dull.
Okay.
Okay. Is this sharp or dull?
Hold on. Do it again. Sharp.
Okay.
Dull.
Okay. And then here.
Dull.
Okay. Here.
Sharp.
Okay. Here.
Sharp. Dull.
Okay. And then.
Dull.
Okay. And then I'm gonna put something in your hand and just let me know what it is. Okay.
Okay.
All right. Close your eyes. Okay. Go ahead.
Ring.
Very cool. And then on the other hand, let me know what this is.
Lighter.
Okay. Patient is able to, hold on, I'm just actually also do another thing. What letter, I'm gonna write a letter on either hand. What letter is this?
B.
Okay.
O, I think.
Cool. All right. Patient is able to note gravistasia and stereognosis. Patient is able to feel pinprick pain on both extremities. Alright, so at this time, Rod, we're just gonna do a cerebellar function really quickly. Can you stretch your legs for me? Then if you can, just slide your heel to your shin. Okay, and then the other side. Very good. And then a couple more things, Rod. If you can, stand up. Okay, and then just walk heel to toe. Okay, and then the other side. Okay, okay. And you just have, very good, Rod. And go ahead and just go have a seat for me. If you can, just touch your finger, or touch your nose to my finger. Nose to your finger, okay. And then do the other hand. Okay. All right, so cerebellar functions are intact. Alrighty, Rod. That completes today's physical assessment. I will let my assistant send you the forms when we're done. Let me just take out my gloves here and wash my hands again. All right, do you have any questions for me today?
No, I guess I'll get the forms when you're done.
Cool.
Yeah,
Thank you very much, Rod. I hope you had a good day.
Thank you. You as well.